How is T-cell lymphoma stage 4 diagnosis? Imagine trying to understand how a fire has spread in a building. That's similar to what doctors do when they stage T-cell lymphoma. Staging helps them see how much the disease has grown and where it has gone in the body. This process is essential for deciding the best treatment and understanding the outlook. First, doctors start with a thorough physical exam. They check the lymph nodes, which are small glands that help fight infections, and look at the skin, liver, and spleen. They want to see if any of these areas are swollen or abnormal, which can be signs of lymphoma. Next, imaging tests come into play. A computed tomography scan, or CORT scan, provides detailed pictures of the inside of the body, helping doctors find enlarged lymph nodes or affected organs. More advanced is the positron emission tomography combined with CORT, called PET-CORT. This scan shows areas of high metabolic activity, which often indicates active lymphoma cells. PET-CORT is especially useful because it can detect even small or hidden disease sites. Blood tests are also part of staging. These tests include a complete blood count to check for abnormal cells circulating in the blood. Sometimes, a bone marrow biopsy is done to see if the marrow inside bones is involved, especially in aggressive or advanced cases. Molecular tests, like T-cell receptor gene rearrangement studies, help confirm if the T cells are malignant and clonally related, which supports the diagnosis. Biopsies are crucial. A doctor takes a small tissue sample from a lymph node, skin lesion, or other affected area. Under the microscope, pathologists look for specific markers on the T cells, such as CD3 or CD4, which help identify the type of lymphoma. These markers also help classify the disease more precisely. To organize all this information, doctors use staging systems. The most common is the Ann Arbor system, which classifies the disease into 4 stages. Stage 1 involves just one lymph node area or a single extranodal site. Stage 2 involves 2 or more lymph node regions on the same side of the diaphragm or limited extranodal involvement. Stage 3 means lymph nodes on both sides of the diaphragm are affected, possibly with the spleen involved. Stage 4 indicates widespread disease, with extranodal organs like the bone marrow or liver involved. Another system, called the Lugano classification, refines staging by including PET-CORT results and symptoms. For lymphomas that mainly affect the skin, like cutaneous T-cell lymphoma, the staging focuses on how much of the skin is involved, along with lymph node and organ involvement if the disease spreads. Doctors also consider symptoms. If a patient has no systemic symptoms like fever or weight loss, they are classified as A. If they have symptoms such as fever, night sweats, or significant weight loss, they are classified as B, which can influence prognosis and treatment choices. In summary, staging T-cell lymphoma involves a mix of physical exams, imaging, blood tests, biopsies, and molecular studies. This comprehensive approach helps doctors understand how the disease has spread and guides the best treatment plan. Because T-cell lymphomas are diverse and can affect different parts of the body, staging is tailored to each individual case. Always remember, the most accurate staging and treatment decisions come from a team of specialists working together. If you or someone you know is dealing with lymphoma, it's important to consult healthcare professionals experienced in lymphoma care for personalized advice.